unfortunately. But yeah, I mean, the things that we look at and we say, oh, that's the worst thing I can possibly think of, to somebody that wants to belong, to somebody that wants to feel loved, that may be a point of pride for them. Yeah, I have this tattoo and it means that I belong to this person. And so, we need to unpack the fact that as people trying to offer help, we have to put our personal feelings aside about that situation, know what to look for, know what to recognize, but don't go into that situation saying, oh, you poor thing, he made you get this tattoo, it's so awful, we can help you get it removed. They have to come to that on their own.
They have to recognize that they have been, they're victims, and a lot of times they don't. This is their choice, this is what they choose to do, and that's a big, just a different perspective that you have to kind of
and this is what Covenant House, this is what you has talked about over and over again, that the people that he hires, although, he'll get applications from people that are well qualified with social work, and I mean, they have all the letters behind their name, so to speak. But he'll hire someone else that can think outside the box, because, and I'm thinking about this as you ladies are talking, because that's really starting to click for me as to why you would need that thinking outside the box, because that while I try not to judge and I try to see all the different perspectives, your first instinct is he he branded you? That's horrible. But yeah, that's, so I imagine there's a great deal of training that goes along with, how do you, with your staff, what kind of training do they receive to work with someone who has been victimized in human trafficking?
Well, all of our staff, because we're a dual agency, both domestic violence and sexual assault, are required by our state to have 73 hours of training, and that's for that confidentiality piece, to have that privileged confidential status. For Act 105, it's that sexual assault piece, and I don't recall how many hours that encompasses.
40, I think.
40 hours for a sexual assault counselor. And then under Act 105, as working with human trafficking victims, you're protected under that confidentiality as well. But it's still an intensive training. I mean, 73 hours is a big commitment to make, but it's necessary to understand, because, as you said, it is very complex.
Yeah, I could see it's very complex, and Michelle, you and I have had some conversations prior to this actual interview, and I'm going to let you talk a little bit about the Human Trafficking Task Force, because one of the big things, I remember the first conversation we had, you asked me to impress upon the viewers that the reason why the general public is excluded, and I'll let you finish that sentence.
Right, and so to back up a little bit before we hit on that, I just, our Human Trafficking Task Force has evolved a lot, and we've actually had this task force for over 10 years now. So our organization has been trying to get ahead of this for a long time.
And a lot, I think, in the beginning was education and awareness, just building that education and awareness about the issue, and we've done a great job.
Absolutely.
And now we're
now
we're
we're
doing the
taking
work.
the next step up. So for a long time, it was really community oriented. It was, we did have a lot of people from the community that have, been in and out of the task force group over the past 10 years. But when we started really doing the work of seeing, okay, human trafficking, this is an issue that we can take on. This is an issue that we can start providing direct service and outreach. It became apparent that, in order for us to be able to talk about these situations, we needed to keep the group small, and we needed to make sure that it included people that were really working with potential victims or survivors of human trafficking, or people that might have the potential to come across them, and offer them direct links to services. And it can be very frustrating as a community member sometimes to see that process unfold. Anybody that works in human services understands that it doesn't happen overnight. And it's because we want to make a lasting difference. So it can be frustrating, and it can be frustrating as a human service worker to get feedback that says, oh, this isn't happening fast enough. Oh, why isn't this happening this way? So it just became very obvious to us that having that small closed group would really allow us to sit down, work on these things, and then be able to present to the community, listen, this is what we got done, this is how we're helping. Now this is a protocol that you can follow if you have somebody that needs help. If you take them to the hospital, this is what will happen. If you take them to the shelter, this is what will happen. If you connect them with law enforcement, this is what will happen. And we really needed that opportunity to get all of us that are providing those services together in a private environment. For our response team, we have everybody sign a confidentiality clause that says, what we talk about in that group stays within that group because it's privileged information. Especially on behalf of law enforcement, they need to know that they can talk to us and feel comfortable that we're not going to say, hey, there's this big operation that's going down. And some of those things, once again, can be confounding to community who think, oh, why does it work that way? It needs to work this way. It just allows everybody to do their job and do it well.
And with a lot of success, I have to say.
Yeah.
I mean, the response team has really put into place a lot of those protocols that are working. I mean, we have had an opportunity to see that change and work collaboratively and have partnerships where that victim is being supported in multiple disciplines, and that really took that work and that kind of behind the scenes. But not to say that community awareness and engagement is not necessary. In fact, we're kind of looking at how we can involve the community, but still have those subcommittees in their disciplines still working out those protocols, and share, as Michelle said, share that with the community and really get the community in general as advocates of the work that we're doing and to increase that awareness and education. So it's just been a process as we've evolved, and it's not perfect, but we needed to kind of address the immediate need, and we've been doing that with success, and now we can kind of look at, okay, now where can we make improvements? So that's where we're at.
And I think, one thing that I will say to the credit of our community member partners is that it's really because of the feedback of the people not doing this work that are part of our task force that helped us understand where those gaps in service were. So we definitely don't want to lose that connection because without that feedback, we need to know what's happening on every level.
Sure.
We identified the biggest issue for serving victims of trafficking specifically was gaps in service, losing track of them because they weren't able to get connected to services as soon as they needed them, which makes sense, right? If you have somebody that's trying to leave any kind of abusive relationship, if they don't have the opportunity to get connected with safety right away in that moment where they're ready to go, not only can it be detrimental to their safety and well-being, but it's also very demoralizing to finally get the courage up to do something and then to have somebody say, oh, I'm sorry, you're going to have to come back tomorrow. We can't do that right now. But if you're a victim of human trafficking and you're not even entirely convinced that you're a victim at all, but you think, okay, this is, I'll give this a shot, and somebody says, oh, I'm sorry, there's nothing we can do for you here.
And that's, I think, one of the challenges too, because some of the victims aren't from this area, right, from York County. And so what we're really finding is that we have to broaden our reach and our network beyond York County, but regionally and even statewide and out of state. I think we have a lot of victims being brought into York County because of the proximity to Philadelphia and Baltimore, and it just kind of that in those crosshairs. So we have to really look broadly and where best can we serve that victim, and so that is something that we're looking at, and being part of the Path 15 collaboration. So that's along Route 15. We have served 12 different counties, and it's a partnership with 6 other agencies, and that has really broadened our reach, but also strengthen our ability to serve victims. And so we're a partner with that, and a funding of federal grant funding has allowed us to continue that work, and even on a bigger scale. So I think it's not just locally, but regionally we need to be thinking about how to best serve our victims.
Yeah.
And I think a lot of times, and this is, just a quick little anecdote. I had a reporter that was interested in talking about human trafficking and contacted me. And, she asked me the general questions, and I told her about what we were doing here on the show. And one of the questions that she asked me was, is there someone that you can hook me up with so that I can talk to an actual victim? And I'm like, okay, well, let me explain this.
Right.
And I think, that she wanted to give that information to the public. It wasn't a sensational thing, because this was a local newspaper reporter. This wasn't somebody, from,
And those personal stories do connect,
exactly.
right? It just, and I understand.
Yeah, and I understand too why she asked. And I just explained to her, okay, this is the reality of human trafficking, and if you want to contact Covenant House, if you want to contact you guys, talk to them, because and even if I did know someone, I'm not going to give you their name, because that is it. I don't care. I mean, not just human trafficking, just across the board. Anyone who's been victimized in any kind of situation like that, whether it's your mental health issue, whether you're child sexual assault, bad marriage, whatever it is, you more than likely have trauma, and you more than likely have guilt, and when you combine those, it's very hard to trust, because you think these are the people that you depended on, and they did this to you. You trusted these people. It's like, how could I trust that person? Well, there's that guilt. Then other people come and say, I want to help you. Really? Well, yeah, he wanted to help me too, and he broke my jaw.
Right. And it comes down to safety too.
Yeah, I was just gonna say.
And I mean, that's why, when we talk about our confidentiality, and I think that's an important thing to kind of expand on, programs like ours, when you are a sexual assault advocate, when you work with domestic violence survivors, when you now, under Act 105, work with human trafficking victims, that confidentiality privilege is real. That means you can't be subpoenaed in court. That means that you cannot, under law, reveal that confidential information that you talk about with someone. And there's a lot of good reasons for that, right? Like, reason number one, people deserve the ability to talk freely without having to worry about what's going to happen if I reveal this. But when, for example, if you think about a survivor of human trafficking, their safety may be at risk. Yes, maybe they're out of that life. Yes, maybe they're now, they've got their life back on track. What would happen if, their new employer found out, if they hadn't revealed to them their past? Oh, by the way, I was involved in a sex trafficking ring, and this was a part of my life.
Yeah.
It's not safe for them in that way, because let's be honest, people may make a judgment call about that. They may not feel comfortable with that person in the same way. It's their right to have the choice to reveal or not to reveal that information to people. There also may be abusers that are still trying to gain access to them. So we are very, very committed to making sure that we uphold that confidentiality, and that community members understand, A, why we do that, and B, for themselves, why that's so important. Because I think we've all had that person where we're just like, oh, I'm so, proud of this person, or I'm so concerned about this person. I want to tell everybody, so that maybe, I want to do an intervention and bring everybody in, and don't do that. It's not safe. It's, like you said, it could be mentally damaging for someone, and it's also just it takes a lot of power away from someone to kind of make their story the most important thing about them.
And that in some cases takes years, and I know how powerful those personal stories can be, but we really have to be very careful of that vulnerability and the safety, and the, if that victim is ready, right? Survivor.
Right.
That survivor is ready to share that, because the consequences and implications can be very great.
And it's their story. It has to come from them.
Exactly.
I mean, that's what I see in the mental health community all the time. And, while I'm very open about having PTSD, I'm very open about being homeless and other things that happened to me, not everyone is.
Right.
And because of that, it's not fair for you to just for someone just to decide, oh, well, you have a great story, I'm going to tell it to such
Sure,
and such.
yeah, now it's my story.
Yeah, yeah.
So I'm just going to tell whoever I
Yeah,
want.
exactly. You go tell your story and let that person
Yes.
decide if they want to tell it or not. I mean, some stories are so amazing that I've encouraged them,
Yeah.
talk about this. You don't have to divulge everything, but just, little bits and pieces that could help others.
Right.
Because sometimes people do want to help.
Absolutely.
A lot of survivors do go on to be fabulous advocates.
Oh, yes.
Well, we see that all the time,
Yeah.
right? That they want to
Fabulous
get back.
advocates. And one thing too, because Ace is giving me like the 9-minute signal or so. But I just want to put up, Ace, can you put up the National Human Trafficking Hotline for the rest of the show here? If you call the National Human Trafficking Hotline, they are a warehouse, so they are a clearinghouse, so they will be able to connect you with like the YWCA, and no matter where you are in the country, they can connect you with local services that can help. Their number is 1-888-373-7888. And then you can also, if you're someone you're in a human trafficking victimization situation, it's not safe for you to call. If you can text, Be Free to 33733. So those are two great connectors there to help. If you are, and I actually, when Dr. Sherry Kim was on the very first show that we did about human trafficking, I actually called the National Human Trafficking Hotline and talked to one of the representatives and explained, okay, I'm not being trafficked myself. I'm somebody that has this little cable show. But can you tell me, what would you tell somebody that would call in? And she was fabulous. It was just absolutely fabulous. They have if you look on their website, amazing information, all kinds of resources, anything you'd ever want to know. The big takeaway point that they gave me was, it's always better if the person being victimized can call or text. If they can't because of safety reasons, then someone else could intervene. But it's always better if they can do it themselves.
And in our,
I was just going to say.
Yeah, I'll let you go this time.
Yeah.
No, I was just going to say we kind of encourage the same, that anytime a victim of domestic violence or sexual assault are looking for services, we really want to hear it from them, because they know their own story better than anybody else. They know what their safety issues, that they know their circumstances, and really to understand that firsthand from them is really critical as we begin to lay out a safety plan or provide options.
Yeah.
And and in order for someone to come in, we can't have someone come in.
Confidentiality too.
Right, exactly. They need to be the person to call. And what we know, and as Jess kind of said, is it really, if for that decision to stick, it needs to be theirs. It can't be,
They have to be ready.
Exactly. You can't be, my best friend's in this terrible situation and I'm just going to call on her behalf because I think I know better.
Yeah.
We know how that situation is going to work out. Anybody that's ever had children knows that if you try to make them do something for their own good, they're going to resent it more than anything.
And then do the
Yeah.
opposite.
Right, exactly.
I think personally, as someone who's been in that situation of having individuals that I know are in trouble, what I have done is I've called for my information.
Right.
How can I help?
How
this
can I
person?
help?
Yes, and
Sure.
I think that's a good way to approach
Sure.
it. I found that's worked well for me.
Yes.
Just to call and say, look, I have this individual. Either it's a friend like my friend's granddaughter, somebody that I know, or some person that kind of I got the feeling that something wasn't right. What do I do? If they come to me and ask for help, what do I do?
Yes. Absolutely.
And that's a lot of people don't know what to do or what to say, right? That fear of doing the wrong thing or saying the wrong thing sometimes prevents them from intervening. And it's something that we talk a lot about in our presentations and talking to young people, that prevention piece. If you see something, how can you intervene in a safe way, in a supportive way? So it's a good conversation to have and encourage people to look for, ways to help.
Okay. We have about 4 minutes left, and which I know we had like the first 20 minutes we had no sound, so and none of us do sign language, and even if we did, I guess not everyone out there knows sign language either, so I don't know how that would have worked, and I didn't have time to make cue cards. So in the last 4 minutes, one thing that I would like to say is I'd like to thank both of you for coming on first and foremost, and I hope you come back and hopefully our technology will cooperate and we can have an even better discussion. But one thing that, and we've talked about this before the show, I talked with you, Oregon, last week and Sarah Keister, and I think one thing that we need to stress is that the people that are victims that become survivors, put it that way, these are not people, these are not women, young men, whoever. These are not people who are stupid.
Right.
They're not bad. They are not, there's nothing wrong with them. It's not that they enjoy what's happening to them.
Right.
And I think we need to start making that distinction that sometimes in our journey in life, we do get off track for whatever reason. We get derailed. It can be through no fault of our own, someone who is born into a horrible situation. They didn't have that choice. And I agree with you so much, Michelle. I always say that I don't think anybody, as a little kid decides, when I grow up I want to be a gangbanger, shoot people, I want to be a drug addict, I want to die from heroin, or I want to do these things. I don't think anybody decides that as a child either. It's something happens. And it goes back to, and I'm sure both of you are aware of the trauma-informed care movement.
Yes.
Yeah.
And it goes back to that trauma, and Ace is giving me a 2-minute signal. It goes back to that trauma-informed care of asking not what's wrong with you, but what happened to you.
Exactly.
So
Yeah, and all of our programs are firmly based in trauma-informed care and sensitivity, and I think that's probably the most important thing that we can share is just...
And empowerment. We want to empower people.
Yeah.
Okay, well, we have a minute left. Anything quickly that you want to add? I'm sure we'll get you back on here again and continue this conversation because it's one that we need to
look
have.
for more news about human trafficking
Yeah.
in York County. We're focused and we're dedicated to addressing the needs of the community, and we'll be here throughout it. So we'll have more news to share, I'm sure.
Definitely.
Right.
Definitely.
Right. Well, I want to thank both of you for coming.
Thank you so much for having us.
Invite you on again
Yeah.
when we have functional technology.
We worked through it. It's okay.
Yeah.
It worked out just fine.
It's thinking outside the box, right?
Exactly.
Yeah.
That's what you got to do. Thinking on your feet.
And thinking outside the box. So next week, I don't know, Annie, if you're out there, if she wants to, try this next week.
Hi folks, I'm Steve Butler. Welcome.